I like the human form. I just always appreciate muscle structures, the curves.
My chest, specifically, is something that I've struggled with and have been bullied for.
It's always affected me emotionally, if I'm being honest. There's a lot of stuff I feel like I might have missed out on.
It's very life-changing, what we do.
If you have the means to do it, I would say go for it.
Work up the courage and do it, and you won't regret it. A couple hours of discomfort is worth the rest of your life having that confidence again and really just feeling like a new person.
Plastic surgery is the intersection of arts with the surgical techniques. It's definitely the field that has the most creativity, the field that requires the keenest eye of the surgeon, the appreciation of the body form and the right proportions. Do unto others what you would like done unto you is a philosophy that I follow, which is, would I want this if I had these concerns? Is this the right procedure for this person if I were in their shoes? And I think that's an important barrier to cross once to decide to operate on somebody is, would you do it yourself?
Probably one of the proudest moments in my life was when I was attending his graduation party from Vanderbilt Medical School.
His study partner and friend
stood up to give his speech, and at the end of his speech he says, and it would be unfair and unjust to finish the speech without paying tribute to Marwan Khalifeh, who, thanks to him, many of us were able to graduate. Everybody stood up and started applauding and cheering Marwan. Marwan always was that. He always had this big heart.
I wasn't born in the States. I'm from a country in the Middle East called Lebanon. I was raised there, lived the first 10 years there. Around 10 or 11, we migrated to the States. My father was a doctor, so that's probably one of the earliest influences into looking at going into medicine, and so is my uncle, so there's a lot of family role models in the medical field. I always wanted to train at the best places, so for undergrad, I went to the University of Pennsylvania, which was my dream school, reaching the Ivy Leagues. Trained in medical school at Vanderbilt down south. That was a great 4 years, spent time in a different part of the country. And then, of course, for my surgical training, I wanted to go to one of the premier hospitals in the United States, which is definitely Johns Hopkins. Johns Hopkins is a very special place to train as a surgeon. It has a lot of surgical history, 100 years plus. Decided to join the military when I turned 40, something that I was looking at. And then I was sitting at my desk and I got a postcard from the Navy and it had a big battleship and it said, serve your country. I knew I was hitting the age. I knew that 40 was the limit of what they would accept. And I decided, it's now or never. Always as a surgeon, helping take care of our soldiers and using my skills in trauma reconstruction for the benefit of the wounded.
I've known Marwan probably since he started at Hopkins. So in the early 2000s, he was one of the residents at Hopkins and he really distinguished himself. He was talented, bright, engaging, superbly analytic. And then when I decided to leave Johns Hopkins and go into private practice, I couldn't think of a better partner than Marwan because, again, good surgeon, good friend, honest, hardworking.
What I love about Marwan's expertise is he dares to try new things. He was one of the first to try the single whole liposuction. He is the one who started treating male breast surgery and became really great at it, that now he is a reference.
For me, as a bodybuilder, this is something that I know I have to get done eventually. If you're standing on stage with another individual, you're being compared, and one person doesn't have gynecomastia and you do, and everything else is the same, the person without the gyno is going to take the prize, is going to win. So in that space, I know that I have to do everything I can to make myself better. And this is one of the steps that I can take, that I know I need to take at some point in my life to be able to give me that edge, that position that I need within that bodybuilding space.
To me, it's a pretty simple concept, a simple procedure, but the degree that it changes men's lives is very impressive. That's part of the reason I enjoy doing specifically gynecomastia.
The gyno is something that's been bothering me my whole life. I've had it since my teenage years. It's always affected me emotionally. I knew I needed to change something, but my mistake was thinking that I could just do it through working out and weightlifting and stuff, which doesn't make the problem go away. And then I learned about the condition, and then I realized, oh, well, there's nothing you can really do to change this.
Female plastic surgery is much more commonly accepted. I think the idea of a man being concerned about his physique is still gaining acceptance.
You're a great candidate, meaning you're working out, doing what you can, yet you still have enough breast tissue.
Yes. I got great vibes from him, like the first time I met him. What really inspired me with him is his confidence. Dr. Marwin really made me feel comfortable, first of all, and then he made me feel confident. He's, said, I can make you look good. And those are the words I needed to hear. So after that, that's why I went with him.
I think the main thing that stood out to me initially was that he just had incredible reviews across the board. People who were not only in bodybuilding or that didn't take working out seriously, but that wanted it for their own lifestyle reason. The fact that he is board certified and just has the experience and that's what he specializes in. Really how transparent he is with his patients, and knowing that I'm not just going into this process with someone that just wants to make a buck. Someone that actually cares about their patients, wants the best for their patients, and really takes everything into consideration. So those are the two main things that stood out to me.
It's very exciting to take a patient through the process from the initial consultation and listen to them and see what they're looking to change, why they're looking to change it. Is it something that they've been thinking for a while, or is it a last-minute decision? Obviously, we like to make sure that it's something that they really want to do, take them through the surgery safely.
They really took care of me. I felt comfortable being in that room. They really did everything they could to make that a safe space for me. Dr. Khalifeh was there. He talked me through it, really made sure that I was still feeling comfortable. I wasn't feeling anything. There's really no pain that I could feel. It was super easy, super simple. I would say probably an hour and a half or so, at least, is what it felt like. And at that point, it was done. They gave me some crackers, some drinks afterwards, really made sure I was comfortable before I actually left the facility. And that, again, made me feel super comfortable and that I made the right decision with Dr. Khalifeh. So it was a great process.
What was day one? How was overnight?
Pretty good. Didn't feel any pain, really.
Not too much pain? Okay. Well, let's take a peek.
All right.
All right. You can take a look. Looking nice and flat, and I don't see any bleeding overnight.
Yep.
So
Looks good.
that's good.
it's a lot more confidence in going out to the beach. I like being outside a lot in the summertime. So there was always that point where I was like, oh, should I take my shirt off? It's like, probably not. Whereas now I'm just going to be like taking it off.
I have not fully seen the after of the procedure, but that's something that I'm very much looking forward to, because this is something that I've struggled with and had insecurities about for many years. And so now that it's done, I'm just super excited to be able to take off the compression gear and see what that actually looks like.
I get postcards, I get emails on how people have taken off their shirt for the first time, gone on a beach trip, boosted their confidence, found a significant other because their confidence was boosted. I mean, it's something that may have caused them embarrassment for many, many years. And then you realize that using your skills can really transform their lives.
I would say that if you have the means to do it and you've been thinking about it for quite some time, which I think most people in this position have been thinking about it for a very long time, I would say go for it.
I want them to actually not feel bad about their bodies. So I want their minds to be kind of free of their concerns that they had before surgery. I want them to feel more confident. I want them to feel more healthy, more motivated. We're always looking for a greater sense of well-being for our patients, and that can help them focus on enjoying their lives.
100% go for it, because I know how it affects the self-esteem, and your life can be so much better. And I know you're probably like I was, where I'm just scared to go under the knife, but work up the courage and do it, and you won't regret it, because a couple hours of discomfort is worth the rest of your life having that confidence again and really just feeling like a new person.
After 44 years of practice, I've learned one thing. Patient appreciates the most about the doctor is the personal care. And Marwan is very personable with his patients. His personal approach is very unique. And his patients especially love him.